New video for all of you. Welcome to our YouTube channel and our web application, in which you have many free videos to watch of our work at R.M.P. International. We talk about a perhaps very important topic for dentists, the centroid relationship. But this topic is also important for other health sciences, since a good centered relationship of the jaw does not interfere with the rest of the body. In this video, we're going to see how it is easily obtained with a very simple device, with the bed body equilibrium device. And if you like the video, give me a like. If you like the channel, subscribe, share our work, and so on, to make the community grow. Talking about central to mandibular relationship is a conflicted issue. We have been trying to define it for years. Many definitions, each one has their own book to be able to determine how to look for it. Mandibular triga is a conflictive topic. In order to determine how to look for it and what it is, I think there are more than 300 definitions of jaw-centric relation, and it is so simple that we complicate it because I create it to sell something, nothing more. The centered relationship of the jaw, dentists have been trying to look for it for years, because there are schools that say that centered the jaw, rehabilitation works better, but the concept goes beyond all that. A good centered jaw will not only make an oral rehabilitation work better, but it will not disturb the rest of the body. And then there will be a harmonic balance between the facial skull system and the postural tonic system. Today we're going to talk about this topic, and we're going to disappoint, but the rest is not going to disappoint of the body. In this video, we are going to talk about the definition of energy relations, which is our concept in the International R.M.P., and how we obtain it in a simple way with a method common to all health sciences. Centric relationship, as its name indicates, is the centered position of the mandible on the glenoid head. How can you obtain that? Simply relaxing muscles. If we relax muscles of the craniofacial system, the joint will go to the centered position on its own. But to obtain this local muscle relaxation, we have to have a good relaxation of the tonic postural system, that is, the entire body. So we understand that centric relation cannot be obtained only locally, and that's why it is important to measure the mandibular position to see if the craniofacial system is disturbing or not with the rest of the body. Not possible to obtain a centric relationship only locally, and that's why it's important to measure the mandible position to see if the craniofacial system is or not disturbing with the rest of the body. Every simple definition of all this is that the centric relationship is the physiological space of the repose mandible. A physiological space of rest is obtained only with muscle relaxation. A local muscular relaxation does not exist if there is no relaxation of the muscular chains. Look at the simple connection between the craniofacial system and the postural tonic system. But a centric relationship without a good vertical dimension is nothing. It means that centric relation and postural neuromuscular vertical dimension go together, are in agreement, synchronized. Center the jaw and obtain a good vertical dimension. The first important thing we have to understand is that the TMJ, that is the jaw joint with temporary use, is not an isolated joint, but is part of a system called the craniofacial system. What is the craniofacial system? It has a balance between all its components, and that good balance of that system does not interfere with the tonic postural system, that is, with the rest of the body. It is part of a system, skull to head system. It's important to center that jaw, center it in the glenoid cavity, mandibular centering in the glenoid cavity. If you see that jaw, it is well centered, but if we do not have a good vertical dimension, that centering is lost. This mandibular centering allows to protect the disc, not compress it, allows not to increase intra-articular pressure, which is very harmful to the TM, and protects the posterior bilaminar ligament in the vital area of the mandibular technical joint. Radiographic control of a centered jaw. That jaw is perfectly centered, in its place, there is no doubt. This mandibular centering allows us to protect the retroarticular area, which is the most important area of the TMS, the one that protects the TMS, because all the innervation and circulation arrives there. That means that the life of the temporal mandibular thumb arrives. And then another concept that we have to clarify, centric relation, is the centered position of the jaw in neuromuscular balance without dental contact. That means that is the physiological resting space of the craniofacial muscles. If we have good muscular balance with craniocervical neuromuscular balance, that will not affect the rest of the body. We will have general health. This concept is important, balance here, neuromuscular, to obtain a complete postural balance. That is the kit of all the postural health of the organism. If we lose that mandibular centering, that will affect the main receptors of the organism, the receptors of the postural tonic system, mainly. First, it affects the oculomotor system. It chronically affects the other receptor, which is the support wedding. These are the most significant changes that a jaw has: antepositions, retropositions, and laterobriations. All of them are going to affect the body in one way or another. They're going to affect the muscle chains and the postural tonic system. And sometimes we wonder how the position of the jaw affects the eyes and posture. A small scheme, but what we say, deviation of the jaw affects ocular mobility, that is, ocular convergence, and this generates stress to the muscular heads and the rest of the body. Well, once we have the jaw centered, we have to have a good occlusion that keeps it in its position. And for this occlusion to work well, you must have a good orientation of that occlusal plane. We also have to have good freedom of movement, good plane, freedom of movement, good occlusion, and good guides, anterior guide and posterior guide, that will protect the mandibular temporal joint. So let's also talk a little about local balance, local muscles. We call the oral corridor a good balance of suction, lips, chin, tongue, and breathing. All of this is also going to be very important for the proper functioning of the rhinofacial system.
Yeah.
Muscles in balance, calcification in balance, a good symptom of local health. And therefore a good clinician must also study all this, the diffusion of the lips, the chin, breathing, swallowing, postural habits, and bad local habits that can affect that good balance of the craniofacial system. Let's see some examples of this diffusion of the oral corridor. Hypotones, lip hypertone, which generate alterations during growth and throughout adulthood. There's hypertone of the chin, lower lip, buccal upper lip. All of this will affect proper functioning of the vocal corridor and posture, facial skull, and postural tonic system. Low tongues, atypical glutition, habits, which also affect the proper functioning of the craniofacial system. And here comes an obligatory question. How does the position of the jaw affect the muscle chains? What does a position of the jaw have to do with the position of the muscular chain? It's going to affect body posture. Well, we're going to see it now. Connection between the upper part of our body and the lower part of our body system. And ideas changes in jaw posture increase intra-articular pressure. And if intra-articular pressure increases, it is harmful to TN. And always remember that bruxism is a defense against that. The pressure between the joint, and if the pressure between the joint increases, it is harmful for the ATM. And always remember that the luxism is a defense against that, against not generating problems to the ATM. A bad defense because it is going to generate and how the ATM deformation. And then it's important to understand that generating the problem, the TMA, a bad defense, because it will generate it, and how the deformation of the TMA. So it is important to understand that generating defensive bruxism, that bruxism will generate muscle hydration, and that chronically affects posture. Important concept to note: when the jaw changes, possession increases intrarticular pressure, which can create irreversible damage to the ROM. For this reason, defense mechanisms are triggered. Those are the retroarticular and the entire joint. And these defense mechanisms are more harmful than positive. By increasing the pressure, we have an alarm from the local receptors that send to the central nervous system saying danger. The teeth are there acting, blocking that position to destroy the teeth. The one who destroys them is Lucia. That generates an infinite circuit that never ends, because every time the teeth are abraded badly, it puts more pressure on the joint. That joint pressure generates more bruxism, that bruxism hyperactivity, and thus chronically general pathology. Bruxism, alarm signal, bruxism, and infinite general pathology. This hyperactivity, little by little, from the height, descends and generates stress to the muscular chains and can reach chronically the grapes, the foot support. That is why it is important to prevent all this. It is important to understand the system, how it works, and how it dysfunctions in order to work in harmony. So those changes in mandibular posture to protect the TMJ, that defense generates more problems than solutions. We trigger the defense russism, which chronically generates a very negative domino effect for the body, with chronic pain and sometimes irreversible injuries. A very common misunderstanding is that russism is caused by stress. That is a lie. Terror. Russism is generated as a defense and chronically generates stress. But it is not the stress that generates the earthquake. This is important, misunderstood, to clarify it in order to understand how to treat the racial cranial system. So if we understood all this, it is important to measure. The environmental posture allows us to measure if that jaw is centered and does not affect the posture. It does not affect the muscle chains. That is why measurement with the Mediterranean posture is important. Let's also remember, those who have taken the posturometry course with me know this. Let's remember that deflective recontacts of the jaw immediately generate load losses in the foot pads. How do they do it? Following this scheme, the teeth pre-contacting the anterior teeth, that is, in the anterior guide, reduce the load on the first lateral metatarsimus of that foot. Pre-contacts in the occlusal plane, that is, between the first premolar and first molar, lose load on the fifth metatarsus, and pre-contacts in the spin curve, that is, the posterior path, cause the heel to lose load, seen from another point of view. Posterior teeth, middle teeth, posterior teeth.
Device.
That is a device for body balance. This single-sized thermoplastic device that adapts to any subject of any age, very simple, with nothing more than hot water, cancels out the negative effect of the craniofacial system and produces muscle relaxation. And if it produces muscle relaxation, the jaw is automatically entered. It's that simple. You don't have to manipulate. Bring it up and down, simple, produce relaxation. That device for any member of the health sciences, doctors, dentists, physiotherapists, osteopaths, always use, which is used at night, relaxes the muscle chains, and among them the facial muscles. Because it eliminates that stress that is causing that poorly positioned jaw at the TMJ, and that has generated the problem by canceling it. We relax muscles if we move away. We relax muscles that we simply obtain the central relationship of the jaw. So I simply cancel the mouth, relax, and stress. And if I relax stress, relax muscles, the jaw goes alone to the central relationship. My job will later be as a dentist. That's what a dentist has to do. Look for the vertical dimension. Central comes that jaw in vertical dimension and build a good occlusion. But the D is a device for all health science that can immediately help our patients. Immediate and simple. Let's now see the immediate effect that the weak produces on our head. A patient with this occlusion, that poor position of that jaw, a lateral deviation that is generating stress, is generating an overload to the left of that patient, measured with the posturometer. We cancel the mouth. If you look, from 2 kilos to 0, immediate effect of B, the body equilibrium device. Immediate effect. Cancel and correct, simple. Way to find the mandibular centric relation. From 2 kilos, 0.3 overload to 0. Let's see another case. Mandible not centered. Lateral mandibular deviation. Overload, kilo 8 kilos. A significant overload of the mandible. From 8 to 3. Immediate effect of the bed. Immediate effect. Don't forget it. This proves that the craniofacial system directly affects the muscle chains. It is important to cancel it, but even more important is to measure it. The bed is a simple device, easy to use. It has a unique measurement, adaptation in the patient's mouth, no impressions are needed, thus eliminating craniofacial interferences quickly and allowing rehabilitation that lasts over time. Non-central jaw, as we see there is a patient with a non-correct jaw position and how they have significantly affected here from a clinical point of view, how it has affected the posture of the organism. The effect of B on posture, here clinically, how the muscle chains and posture of that subject have improved. Also seen in lateral position. What can we say in conclusion from this? Simple. Study the craniofacial system well. The craniofacial system is a constant disturber of our organic posture, and so it is very important to understand that we must study it in a precise way and understand how we cancel it, our cranial system at the same time. If you liked it, always remember to give the video a like. If you like the channel, subscribe. They follow our application. Our application has these free videos, they have our courses and so on. But the videos that are free, and from time to time we give away a course for those who join our application. And if you like the channel, subscribe to the channel. That helps the community grow, and we will see you in the next video of the club's international R.M.P. Subscribe, bell and like. Bell and like, you can't hear it.